this lecture, I am going to discuss about GLP-1 analogs, the mechanism of action, benefits or the advantages, adverse effects, contraindications, the recommendations for its use and limitations of GLP-1 analogs. So GLP-1 analogs represent a class of anti-diabetic medications that are used for the treatment of type 2 diabetes mellitus. Examples of drugs that belong to this class are exenatide, liraglutide, dulaglutide and semaglutide. So how do these drugs act? These drugs act through incretin mechanism. The glucagon-like peptide 1 and gastric inhibitory polypeptide, these are incretin hormones and they are secreted from the gastrointestinal tract after ingestion of food or oral glucose. So these are known as incretin hormones and the effect is known as incretin effect. So they lower the postprandial blood glucose level through 5 important mechanisms: by promoting insulin secretion, by suppressing glucagon production, by slowing the gastric emptying, by increasing the satiety, and also these drugs have known to restore the pancreatic beta cells. So through these mechanisms, they help in lowering the postprandial blood glucose level. The GLP-1 analogs are also known as GLP-1 receptor agonists because they activate the GLP-1 receptors in the pancreatic beta cells and hypothalamus and other sites, producing their effects. They are also known as incretin mimetics because they stimulate or enhance the actions of incretin hormones, namely the GLP-1 and GIP or gastric inhibitory polypeptide. So these drugs stimulate enhanced action of GLP-1 and GIP, thereby lowering the postprandial blood glucose level, lowering the glycosylated hemoglobin. And these are known as GLP-1 analogs or incretin mimetics or GLP-1 receptor agonists. So in this lecture, I will be focusing my talk on GLP-1 analogs and comparing with the other anti-diabetic agents. So the next question is, how are these GLP-1 analogs administered? Now, most GLP analogs are available as injectable peptides with the exception of semaglutide, which is available as an oral form. So, a novel oral formulation of semaglutide has been developed and it is tailored for gastrointestinal absorption and oral bioavailability. So most of these drugs are available as daily or weekly injections. When administered subcutaneously, they are rapidly absorbed and achieve peak concentration within hours and are highly effective in lowering the blood glucose level and lowering the glycosylated hemoglobin in type 2 diabetes mellitus. So next we come to the benefits or the advantages of GLP-1 analogs. In terms of efficacy, they are highly effective drugs for lowering the glycosylated hemoglobin. Studies have shown that GLP-1 analogs reduce glycosylated hemoglobin by about 1% compared to DPP-4 inhibitors that reduce glycosylated hemoglobin by 0.6 to 0.8%. So these are highly effective drugs for lowering the glycosylated hemoglobin by decreasing the postprandial blood glucose level, the fasting blood glucose level, and the glycemic target range is attained. Now, the second benefit of GLP-1 analog is weight control. So, high-dose liraglutide and semaglutide are FDA-approved pharmacologic treatment for the management of obesity and they can be prescribed in overweight individuals with comorbidities. This is because these drugs have been known to reduce body weight by about 3 kgs and this is very useful in an obese individual in type 2 diabetes mellitus. The mechanism through which these drugs reduce body weight is through activation of GLP-1 receptors in the hypothalamus, thus decreasing the appetite, decreasing the food consumption, increasing the sense of abdominal fullness, improving satiety, and this helps in long-term weight loss in obese individuals. Also, there is a second anti-diabetic drug class known as SGLT2 inhibitors that produces weight loss. While in contrast, DPP-4 inhibitors and metformin are considered to be body weight neutral. They have no effects on the body weight, while sulfonylurea, an oldest class of anti-diabetic drug, and insulin are known to produce weight gain. The third benefits of GLP-1 analogs is with respect to cardiovascular effects. So these drugs are known to mitigate cardiovascular risk. GLP-1 analogs have been demonstrated to reduce body weight, decrease systolic blood pressure and diastolic blood pressure, and reduce total cholesterol. In terms of cardiovascular effects, GLP-1 analogs improve myocardial contractility, ejection fraction, cardiac output, coronary blood flow while reducing the myocardial infarct size and reducing the overall cardiovascular event risk. Therefore, GLP-1 analogs are highly recommended in individuals with atherosclerotic cardiovascular disease such as prior myocardial infarction, stroke, congestive heart failure, and so on. Liraglutide, dulaglutide, and semaglutide. So these are some of the GLP-1 analogs that have proven cardiovascular benefits, and they are preferred in individuals with established cardiovascular diseases. On the other hand, DPP-4 inhibitors are neutral for cardiovascular effects, while sulfonylureas increase the incidence of cardiovascular events. The fourth benefit of GLP-1 analogs is with respect to renal outcomes. The GLP-1 analogs have demonstrated potential in reducing the progression of chronic kidney disease. It has been seen that GLP-1 analogs prevent new onset macroalbuminuria, reduce the urinary excretion of albumin, and slow down the decline in glomerular filtration rate. Through these effects, they reduce the decline in chronic kidney disease and is beneficial in the type 2 diabetic patient with chronic kidney disease. When compared to other anti-diabetic drugs, GLP-1 analogs have superior renal outcome compared to DPP-4 inhibitors. So DPP-4 inhibitors have no beneficial action on the kidney and they need dose adjustment at GFRs less than 60 ml per minute because they are excreted through the kidney. While GLP-1 analogs can be prescribed in patients with GFR greater than 30 ml per minute, however, caution is necessary in moderate to severe renal failure. While GLP-1 analogs, when compared to SGLT2 inhibitor, which is a newer anti-diabetic drug class, the SGLT2 inhibitors have better renal outcomes compared to GLP-1 analogs. So GLP-1 analogs are better than DPP-4 inhibitors, but SGLT2 inhibitors have still greater beneficial effect on the kidney compared to GLP-1 receptor agonist. So now we come to the fifth benefit of GLP-1 analogs. The GLP-1 analogs have been associated with low risk of hypoglycemia. So no major hypoglycemic episodes have been reported. However, hypoglycemic episodes may occur when combined with sulfonylureas and insulin secretagogue known to promote insulin secretion, causing reduction in blood glucose level and increasing the chances of hypoglycemia. So when combined with sulfonylureas, dose adjustment should be a consideration. So now let's discuss what are the adverse effects and contraindications of GLP-1 analogs. The side effects that are most reported with GLP-1 analogs are gastrointestinal side effects that includes nausea, vomiting and diarrhea. So these gastrointestinal side effects are most prominent when GLP-1 analogs are injected initially or after increasing the dose of GLP-1 analogs. Secondly, GLP analogs are also associated with hypersensitivity reactions. This is because the individual produces antibodies to the drug and the anti-drug antibodies can interfere with the efficacy of the drug and can also lead to injection site reactions because these drugs are mostly available as injectables and are associated with injection site reactions, and this is associated with high discontinuation rate of these drugs. So gastrointestinal side effects and hypersensitivity reactions leading to injection site reactions remains a limitation of these drugs. So now coming to the contraindications with GLP-1 analogs. GLP-1 analogs are contraindicated in pregnancy and lactation. Secondly, these drugs have been known to stimulate calcitonin release from the C cells of the thyroid gland and are known to produce medullary carcinoma of thyroid, which is a C cell tumor of the thyroid gland. Therefore, these drugs are contraindicated with a personal and family history of medullary carcinoma of thyroid and multiple endocrine neoplasia 2, which is a syndrome or a disorder that affects the endocrine glands and organs and causes tumors in the thyroid gland, parathyroid gland and adrenal glands. So these drugs are contraindicated in multiple endocrine neoplasia 2 and medullary carcinoma of thyroid. The next contraindication is acute pancreatitis because these drugs have been known to produce fatal hemorrhagic and necrotizing pancreatitis. Therefore, GLP analogs are contraindicated in an individual with a past history of acute pancreatitis or pancreatic carcinoma, although the mechanism for pancreatitis is not known. However, caution is necessary in individuals with moderate to severe renal impairment because these drugs are excreted through the renal pathway and therefore they can be prescribed in mild renal impairment, but caution is necessary in severe renal impairment. Also, these drugs should be used with caution in patients with gastrointestinal diseases such as diabetic gastroparesis or inflammatory bowel disease because these drugs are known to cause GI adverse effects. What are the recommendations for the use of GLP-1 analogs? GLP-1 analogs are initiated in case of metformin failure because metformin is the first line drug for the management of type 2 diabetes mellitus. So in case of metformin failure or intolerance to metformin, DPP-4 inhibitors, SGLT2 inhibitors or GLP-1 receptor agonists can be used in place of metformin. Secondly, these drugs are highly recommended in individuals with established cardiovascular disease such as prior myocardial infarction, coronary artery disease, left ventricular hypertrophy because these drugs are known to increase the coronary blood flow, improve the myocardial contractility, increase the ejection fraction, and therefore these drugs are recommended in established cardiovascular diseases. Thirdly, GLP-1 analogs are preferred when the GFR is less than 60 ml per minute and when there is excretion of albumin in urine. Lastly, GLP-1 analogs prevent hypoglycemia and weight gain and therefore used in obese individuals with diabetes mellitus. So what are the limitations of GLP-1 analogs? The main limitation of GLP-1 analog is the cost of treatment. So the cost of treatment is considerably higher than other antidiabetic drugs such as DPP-4 inhibitors, sulfonylurea, metformin. Secondly, the need for daily or weekly injections is a limitation for the use of GLP-1 analogs. So this can lead to discontinuation rate and decreases the adherence. This also discourages the patient to initiate treatment with these drugs. So to summarize today's lecture, we have discussed the mechanism of action, the benefits or the advantages of GLP-1 analogs, which includes efficacy, weight control, positive cardiovascular effects, positive renal outcomes and low risk of hypoglycemia. Adverse effects that limit the use of GLP-1 analogs are gastrointestinal side effects and hypersensitivity reactions. Beyond this, the cost of treatment and the need for daily or weekly injections remains a limitation for the use of GLP-1 analogs by the patients with type 2 diabetes mellitus. So thank you for watching. If you find my video useful, please like and subscribe to this channel.